Good morning or good afternoon, everyone, and welcome to the Asset-Based Community Development Cohort Improving Equity in Community Grant-Making webinar. And this is being put on by Data Across Sectors for Health. I am Waldo Michaels Carrasco. I am the new director of the Center for Health Information Sharing and Innovation at the Illinois Public Health Institute, and one of the co-directors of Data Across Sectors for Health, or DASH. We are in a time of transformation right now at DASH, but also we're building on years of experience and of collaboration. Susan, do you want to advance the slides there?
Yes.
Okay, thank you. DASH is a collaboration with the Michigan Public Health Institute and funded by the Robert Wood Johnson Foundation. Go ahead and advance. So a little bit about DASH and basically what our strategies are. The idea behind this is that we build skills and capacity at the community or the regional level that recenters power towards more local community control and agency. How does DASH build capacity with communities to strengthen community voice in data sharing across sectors and increase the ability to use data sharing as a tool to advance health equity and racial justice? Well, we do that by developing the evidence base for the field and documenting lessons, insights, and artifacts from the project activities. And lastly, we promote relationships among experts, practitioners, and public health and private sector leaders to create or co-create and extend a national movement in support of local community-based collaborations and data sharing. So our two main strategies to build local capacity is to have funding mechanisms and a robust peer learning community. We have learned from these programs over the last 5 years, but have the opportunity to build our transformation happenings all across sectors and in the US society especially. We have the opportunity to start trying to align around thinking globally and acting locally, which is not an easy task. Melissa Moorhead has been managing community awards for DASH since we started and has proposed some innovations for the last round of this type of funding for this phase of our program office. Melissa?
Thank you very much, Waldo. Susan, could you go to the next slide, please? As Waldo mentioned, I've been with DASH since the beginning, and we have had a number of different kinds of funding opportunities that you saw on the last slide. And one of the things that DASH has been committed to, with support from our funder, the Robert Wood Johnson Foundation, is being a learning institution and iterating on our funding programs and the kinds of support we offer communities. So one of the things we started thinking about during 2020, in a time of great challenges and transformations across the United States, was really about how our work intersects with racially focused community justice work, with trying to promote equity in communities, as well as sharing data across sectors for health. So once we started asking ourselves these questions, we tried to think about whether we might make a shift that other philanthropies were making, away from program models that create a call for proposals that then invited us to try to figure out who was a best fit applicant based on our process for collecting proposals, to thinking more about, well, what are the organizations and the work that we would like to fund, and how do we then create a process that would support the best fit applicants? And that whole process is supported by other philanthropies. We've learned a lot along the way, but what we've learned a lot, or mostly, is that we still have a lot of questions. So we've decided, we very much support a model of leading by stepping back, which you'll hear more about in the next portion of this presentation. But in doing that, we wanted to be mindful of how can we step back and try to learn more from community collaborations, how we might best support them without actually making more burden on local collaborations to help us do that. How do we do that and make sure that we are documenting our lessons along the way that we can share with other philanthropies and with other collaborations to help them move along? So we started wondering, can we support or can we try to apply a community-led co-creation process to a whole funding opportunity? Actually increase or try to improve our own focus on equity as a grant maker. So one of the things that we are leaning into is our experience and the flexibility that is offered by the Robert Wood Johnson Foundation to try to make more of a learning cohort than a program model or a program along those lines, and try to reach out to and figure out how to support non-traditional applicants. We learned along the way that we aren't sure whether or not we are being equitable in our grant making or supporting equity in the way that we would like, simply because we haven't collected the right information, or we've been very focused on our own models instead of saying, hey, what actually do communities need in all the myriad configurations that are out there that would actually help us help them support local infrastructure that actually leverages community data ecosystems as an asset in a way that is equitable, accessible, and actionable by and for communities, and communities writ large, and also very specifically that make sure that the residents and institutions that make up communities are leveraging that asset. So what some of the things we tried to do and building out this opportunity is to go out looking again for what we want to fund. So hopefully some of you all are approaching this because you got an email blast. Whether or not you were aware of it, we reached out to all of the former applicants for any of our funding opportunities. We asked other philanthropies if they wanted to offer email addresses of other applicants to their funding programs, and just tried to start spreading it out as much as possible to get people interested in just finding out what this is all about. We wanted to make it easier to apply for funding and accept funding. And we also, again, wanted to try to co-create the process with applicants. So what does that mean in real terms, in real world terms? I'm mindful in doing this, one of the main bits of feedback that we always get in a funding program is participants who would prefer that we're very much explicit about what's needed, when it's needed, how it's needed, and how a participant might understand their own success in that program. But again, here is where we are in a place where we're trying to remain as flexible as possible, which does create a lot of uncertainty. And so I apologize for the uncertainty along the way, but do have some more outline to offer you moving ahead for the rest of this particular funding program and this webinar. So next slide, please. So right now, where we are is in the administrative process, where we're trying to marry all these different thoughts and approaches that we're taking. And so what we have for you is a proposed timeline and a little bit more information about the funding itself and how we hope to administer it. Again, maximum flexibility, maximum uncertainty. So there are things that are called proposed, but there's enough I hope to be getting on with in terms of piquing your interest and getting you involved in the process so that we can learn together and eventually end up supporting some great community collaborations. So we have just a short period for this application phase. We'll return to this application at the end of this webinar. I want to step through it because the application is meant to be descriptive. It's not a proposal. We're not asking you to propose your own activities or what you think you might want to do, so much as saying, like, we have a curriculum for you and we'd like you to participate in it and help us learn from it. And so it's very descriptive. Again, we'll look at that in a bit. So the week of Christmas, we will notify finalists. We have the ability to support 30 to 40 finalists. So another question we get quite often is how competitive is this process? And I will say, as I always do, we don't know until we know how many applications we receive. Applications over the course of the last 18 months have been dropping for a lot of different kinds of funding opportunities, quite possibly because it has been a time of great change and a lot of different kinds of funding opportunities out there. So I think in some ways there's more competition for your attention and willingness to participate in a program such as this one than there is at this point, maybe for the reverse, how many people might qualify for the funding. So depending on how many applications we receive, we'll notify finalists of the week of Christmas, and we'll have a template to ask finalists to start thinking more deeply about their community collaborations and present their collaboration work and how they want to use the participation in this cohort to advance their work and support the creation of or this insights into leveraging community data ecosystems through asset-based community development. We have a little bit longer period of time for that, and we will make some mini grants available of up to $2,000 to support that process. Again, when we're trying to balance money and time, we'll be able to support your applications more monetarily at this time to, maybe replace some income from applicants who might not do this type of application for a living, but would be great to lead it. So that's the kind of thing that we want to support with that particular round of funding. Then we'll have a period where we'll review the community showcases. We'll ask every applicant or every finalist to review community showcases and select the 10 that seem to make the best cohort or would be the right group moving forward. And then those awardees will receive up to $22,000 depending again on numbers that we get in and are eligible and apply to participate in a very intense curriculum between February and August of 2022, where we'll go through the development curriculum and reporting out for the learnings. So that said, big picture overview, we'll return to some more specifics at the end as far as the application goes. But it's important as you are moving into this to pay a little attention to what is the asset-based development community development curriculum. So with that, I'd like to ask Susan to put up a poll about whether you've heard of asset-based community development and ask Daryl Answer, who will be one of our coaches in the process, to take over as soon as we see what some of the answers are. Thank you. Oh, and then at the end, of course, we'll have some Q&A. So as we go along, please don't be shy to use the Q&A feature to ask any and all questions. You can also use it to make comments. Since we are learning as we go, we will try to reflect both on questions and on comments about how well we're doing along the way. So thank you very much, and I will be talking at you later.
Melissa, thank you. Thank you very much. Yeah, so hopefully you're going to have a moment to fill out these poll questions based on your experience and knowledge of ABCD, and that will just help us as we move forward in the curriculum, and just to get a better grasp of all of you who will be participating with us. My name is Daryl Answer. I am so glad to be with you today to share about this opportunity that we have, and myself and my colleague Ron Dwyer-Voss. We're going to take some time to share with you just the basics, like an introductory overview of asset-based community development. So Ron will be pulling up some slides for us here shortly. And the poll questions just came in. I've just seen them. Okay, so looking good. So, all right. So most of you have heard of, but are not familiar with ABCD. And 23% of you only heard of it on Sesame Street. That's awesome. All right. 27% have read about ABCD and are somewhat familiar. 14% use the framework, use the tools occasionally, and then 5% use them every day. That's very helpful. Thank you. Thank you for participating in that. All right, so ABCD. Some of you who have heard of asset-based community development may have heard a name John McKnight or Jody Kretzmann, but asset-based community development precedes our friends, John and Jody. And asset-based community development simply is a way that many marginalized communities survived. It's this idea of people using what they have, pooling their resources together in order to get by. So the origins of asset-based community development go back before the ABCD Institute, but it was actually John McKnight and Jody Kretzmann in the writing of what we call the Green Book, right? Where we actually get this framework, which is packaged and is easily accessible for so many people to use those tools. So as we talk about asset-based community development, it's really a way that people have survived, that they have lived. And it's around this idea and this big question of what we have. Ron, if you can go to slide number 2. Usually when we think about our communities, and for those of you who are aware of ABCD, you may have even seen this map before, right? But usually when we look at our neighborhoods, when we do community development work, and even as we're trying to pitch ideas to the philanthropic community, many times we focus on the needs, right? What needs are out there? And there's so much emphasis on the needs, and we know the needs, we can label all of the needs. But with asset-based community development, like I mentioned, we begin with the assets. On slide number 3 is where, if Ron can go to the next slide, we can look at the assets that exist in our communities. So many of us will do needs maps, but in asset-based community development, we really want to look at those assets that exist within our communities. And Ron's going to get to those specific assets in a moment and break that down for us. But these assets that we're going to look at together, they exist in all of our communities. So moving from needs to assets, that doesn't mean that we ignore the needs. That doesn't mean that the needs magically disappear. But how we begin our community engagement is based on what we do have together collectively. All right, so next slide, Ron. In asset-based community development, or in any type of social change work, there are these 3 areas that we see where we see change happen. The first is in dismantling of systems. Second is change within systems. And then the third is creation of alternatives. So in asset-based community development, that framework, that way of organizing people can exist in all 3 of these ways that we see social change take place. Asset-based community development can work within the dismantling of systems. It can take place within change within systems. And then asset-based community development can exist within the creation of alternatives. But remember, the main emphasis is beginning with the gifts and the assets that exist within the community to begin with. And we also, as Melissa had mentioned, we want to go about this in ways that lift up equity, where everybody gets what they need. And we also eventually want to get towards justice. But at the heart of asset-based community development, we begin with what people have. Well, we also believe that every single person has inherent power. So when we do this work of community organizing through this asset-based lens, we don't believe that we are bringing power to a community. But what we believe is we are coming alongside people who have inherent power. And we're in a way creating space for that to become a reality. So next slide, what we're going to do, we're going to compare the ABCD approach to a social services approach or social services model. And this slide really helps us get an understanding of the difference between an asset-based approach and a social service model. So like I mentioned, we focus on the assets. We build from opportunities. It's more of an investment. There's an emphasis on associations, which Ron is going to get to and unpack that for us. We focus on community. The goal is empowerment, but not in a sense of like, I am coming and bringing, but it's like, no, you have the power, and we just create space for that. Power comes from relationships. people are the answer, and people are partners and producers. Okay, and we know social service models very well. They need needs. They respond to problems. There is an orientation around charity. The emphasis is on agencies, focus is on individuals. The goal is service. Power comes from credentials, which is usually those who come from the outside in. And programs are the answer. And then people are recipients and clients. So there you have the distinction between the two, of asset-based community development and a social service model. As we talked about power, and that everyone has inherent power, in asset-based community development, there's a tool that we like to use called the resident power ladder. And you should see that on your screens. As you saw in the social service model of community engagement, residents are clients and recipients, and they're kind of on the bottom rung of the ladder. But in asset-based community development, what we want to see is those in our communities move up the ladder, moving from recipients to having information, to then being advisors and advocates, and then eventually the residents being in control. Those who are closest to the challenges, they are the ones who come up with the solutions. So that's what we talk about, leading by stepping back, right? And that's what we hope to see institutions do as they come alongside communities and residents and helping them move from recipients of services to then residents who are in full control of what happens in their community. There's another diagram or graphic that captures this powerfully. And this graphic that you're seeing here was created by some colleagues of ours in the Institute. And in this graphic, I love how it shows kind of like this spectrum of community engagement, right? And this idea of moving from doing to community, doing for, doing with, and then doing by. So again, we're addressing power and who gets to dictate the end results or even the journey that we would travel on, right? As we talk about equity and everyone having what they need. We want to move to this place, and asset-based community development, we want to get to this place where things are done by the community, right? So that's what we're going to talk about. That's the journey we're going to go on as we go through this grant process together. But that's just a quick overview. And now Ron is going to share with you some of the specific tools and techniques of asset-based community development.
Thanks, Daryl. My name is Ron Dwyer-Voss. I, like Daryl, I'm a steward at the ABCD Institute and do my work based in Oceanside, California, North San Diego County, which is on the unceded lands of the Payam-Coewicham peoples. And we are really excited to be part of this opportunity to drive some funding into communities to hopefully catalyze some community-driven change around health equity. So Daryl sort of outlined the framework and the approach of asset-based community development. One of the challenges people find of it is that there's not a formula, there's not a step 1, 2, 3, 4. But we do know that there's a number of tools and activities that communities employ that really help this approach work. And so we just want to touch on those, and you will get the slides at the end and a handout from us, as well as some resources at the end of this to dig deeper into them. And then, as Melissa said, part of the whole program is those who end up in the cohort will get some training and coaching along these. The tool that many communities start with is called asset mapping. It's probably the most powerful of these, one of the most powerful of these tools, and also probably the most misapplied. Asset mapping is not making a resource directory of services to refer people to. It's the process of identifying where the community's assets are, where power is or can be leveraged. And what we find is that in most communities, most assets can be found in one or more of these 6 buckets, if you will. And we'll just go through them real quick. Obviously, individuals, their gifts and skills, often overlooked in community change efforts. People have things they know how to do, and they can contribute those, and that can create quite a bit power in the community. And we found that it's especially powerful and changes the narrative when you seek to include traditionally excluded people who aren't part of decision-making tables. When you bring them into the process, it starts to change things. So asset-based community development relies heavily on people offering their gifts and their passions, which is why we emphasize associations. And by that, we mean informal groups who generally small, where people come together and connect already about an interest they already have. It could be book clubs, it could be moms groups, it could be walking groups. What we find powerful about associations is that people pool their gifts there. They combine their gifts in the same way the image of a choir brings individual voices together and produces something that's greater than the sum of the parts. Associations are really good at doing that. They're really good at making space. And it's where people already connect. So you don't have to call a new meeting, just go to their meetings. The other group of people that are important in communities are institutions, generally three types: for-profit, not-for-profit, and governmental. These are formally structured organizations. You know them well: hospitals, libraries, schools, Target, city government, county government. They are formally structured and people work towards repeatable goals, and we want that. We don't want hospitals to decide to be a book club on Saturday. But they are more formal and sometimes harder to work with because of that, but they bring great resources, just as DASH is an institution bringing resources to communities and organizing how to move money from Robert Wood Johnson into your communities. Institutions are resource abundant, and so we want to know where they are in a community. The fourth asset bucket is physical assets, basically the spaces and places within a community. Vacant lots, trees, creeks, playgrounds. Exchange is the fifth one. It's often the hardest one for people to come up with. It's where people share productive work and gifts. It can be a local tool shed club exchange thing. It can be a farmer's market, where it can be any sort of gig economy that's going on. Local mom and pop stores usually fall in this category, whereas a Target or a Walmart or something like that would be in the institution category, because these are exchanges is where people come together to trade and exchange gifts and skills, and they can decide when and how they do it. The last one is stories and culture. We find that there's great power in communities when we look at what's the culture of the community, what are the stories of the community, when is it at its best, when is it energized, when was it at its best, what's carried through over the years, what's important to people. That when we ask those kinds of questions, that we find community assets. Asset mapping can be done in a variety of ways. Daryl showed this slide of a lot of people just take these worksheets that you'll get and get together with people and start brainstorming and just writing them down. That can be powerful. Some communities put up maps and post-it notes and that kind of thing, just to kind of get a physical sense of where assets are and where they aren't and where they might connect better. A lot of communities do it with a group of people, a couple dozen people in a church basement with flip charts around the room, and identify the assets they have. It's a very powerful process for a community. In this picture, they took their first asset mapping and made them into, what do you call these, centerpieces on tables with pictures of all their community assets, and then had a pancake breakfast in a machine shop. And based on what they saw in their assets, they went around and then used how they wanted to reconnect the assets to create more power to create change in their community. So there's any number of ways that it can be done. The important thing is that it's done by the people in the community, and that it's not a one-time document. It's a living document that you revisit and figure out how can we rearrange these assets, reorganize these assets in a way that can help us create the community we want. A lot of times at the end of that process, or sometimes just independently, we call it the tool of 4 questions. What can community members do by themselves, given all the assets we have? What can community members do with some help from outside institutions? Often it can be very useful to have somebody host space or provide some funding for some critical items that are needed for an event or something like that. What can only be done by outside institutions. And in that case, it's important to have that conversation and get a seat at their table versus what we talk about in ABCD is often making our own table. And what should institutions stop doing? And so we change the table or we get rid of it. The power ladder Daryl talked about, really useful tool of analysis. In this case, we had some public health officials and providers put it on a floor. They were talking about where youth connect in their community, and we had them write down all the places youth connect on yellow cards and then place it on the power ladder. You know, what they found was that youth were often recipients of things and sometimes were asked to be advisors or advocates, but rarely in control and rarely considered the source of information. So then you have a conversation about why is that and how can you move that? The other tool that's super powerful and it's really hard to do asset-based community development without is the learning conversation. Those of you in organizing will recognize it. It's often referred to as a one-on-one, although ABCD puts a little different spin on it. It has these 5 goals about deepening relationships, discovering passions, identifying mutual interests, inviting engagement, and then connecting with others, asking the people we're having conversations with who else we should connect to. But we're really looking at not just the things they care about, but which things they care about so much they're willing to act on. We find that that falls usually in these 3 categories: something they hope or dream for their community, concerns or fears, and often just the ability to offer their gifts. Just an invitation to be invited to offer what they have to offer can be enough to get people to act because they know that that's unique to them. And so if they show up, it matters. Another tool is capacity inventories, and the ABCD Institute website has a lot of examples of this in various forms of detail. But the most basic is the Hands, Head, Heart, where you have people identify things they know about or enjoy learning about, things that they're good at doing, things that they care deeply about, and share that with each other. I've had community meetings where 20 people have done that and shared it with each other and come out very excited and newly capable of doing community projects that they've all wanted for their community. They just didn't know they were surrounded by people who could help them do it. So these tend to be very powerful to reveal the individual assets in a community. House meetings are basically like associations, except the common interest isn't necessarily a book or walking, it's the person who's hosting the meeting, and they bring together their connections and their networks together to have conversation and build relationships in order to create some vision for what they want to do in their community. Whichever tools are used, basically ABCD takes down a different path than especially, you know, health providers a lot of times are required to do needs assessments. And that often, and planners, I went to planning school, we were told how to do needs assessments. You identify what the community needs, you create a program to meet those needs, and then you promote the program so people participate in it. And then you hire consultants to come help you deal with the lack of participation. Residents in that model are consumers and passive and without power. It doesn't mean that it's not important in many cases. After a disaster, this can be really important. If we're hungry, this can be important. But even those cases, I've found that this process on the right-hand side is more powerful and creates more sustainable change, where people come together to identify what the community has. With the help of institutions, they facilitate space for the community to connect and share what it has and get what it wants. Institutions lead by stepping back, but not out. They stay engaged, and residents are co-producers and cultivators. If this right-hand process is happening with the tools you're using, then you're doing ABCD. If you're sliding into creating programs and trying to convince people to participate, you're probably not fully tapping the community's assets. So short slide on the purposes of these tools. I'm trying to go faster so there's time for you to see the application. But it basically provides some real data for what the community has and what it wants in a way that helps people imagine that for themselves and each other, and can see that what they have tools to create and what they need to lean on others to help them create. This slide has particular resources we want to call up to you. The ABCD Institute at DePaul University, as we've said, has a number of resources on their website. There's an affiliate online community called ABCD in Action you can join for free and look through their stuff. There's two we're highlighting here that were developed with actually the Institute of Museum and Library Services, of all people, on unlocking the power within neighborhoods using learning conversations, and some more detail on that, as well as how to use the power ladder. And then Bridgespan Group put together a great article that really goes back over the framework pretty well on moving from input to ownership. And we'll also, with these slides, attach a handout that has some worksheets along these lines to help you along in the process. So as you think about your communities and how to engage folks in using their assets to drive change towards health equity. And I think that's it for us. I'm going to turn it over to Melissa to, oh no, Daryl, you're going to share an example. Sorry, my bad.
That's
this is
okay.
an important example.
It's okay, totally okay. Yeah, so really quickly, I wanted to share just a simple example of what this could look like. So a number of years ago, I was asked by a local hospital. I live in Kansas City, so I was invited by a regional hospital here to help with some needs assessments, which hospitals have to do. And part of that is to get some federal money. And so I was given a small grant to hold community conversations to find out the needs. So after some conversations and a few meetings with this hospital's community engagement department, I asked if we could kind of flip the conversation a little bit. So not only look at the needs, I told them we will get the data that you want, but we also need to challenge just this idea of only looking for needs in the community. So what I did was I took those resources that were given. There was a school that was proximate to this hospital, and we began having conversations around how the hospital could kind of view the surrounding community as a patient. So what we did, we had one of our conversations, our listening sessions at the school, and I trained and paid a number of the parents to be facilitators. And at that meeting, the community engagement department from the hospital, they came and joined the conversation, and we did asset mapping. We talked about the challenges, but together we mapped the assets that existed in that community. And then we're able to influence then the assessment that was created by that hospital. It wasn't just the needs, but it also was able to highlight the strengths that also existed in the community that can also meet those needs. Something surprising happened also. So the director of that community engagement department, she enjoyed the food so much, and I paid one of the grandmothers at the school to cater the meal. She then started providing meals for the director as well. So there was just this beautiful relationship that was kind of created in the midst of trying to change the narrative. This community that was right next to this hospital was no longer seen as a place that needed to be fixed. But not that they dismissed the needs, but then they recognized that there were assets, there were strengths, and that there were a group of parents who were willing to engage that they just had never been asked. So that's just one simple example of what this could look like.
I think it's important for those of you who aren't familiar with it. It's asset-based community development. It's not just positive thinking. It's not about ignoring the needs. It recognizes that especially systemic racism in the United States impacts a lot of communities and is the source of a lot of inequities. But it's about starting not in the needs area, but starting with the community and what it brings, so that it can reorganize that in a way to influence change, often by creating its own change internally first, which then helps build power and creates increased capability and wider inclusion of the people engaged in getting outside powers to behave the way that we want them to. So Melissa, how are people gonna get to be part of this?
Well, thank you for the exciting introduction to it. And just as it is not positive thinking, not just positive thinking, I will say there is a lot of work to be done on all sides, our side and the applicants and participants. So one of the things I mentioned earlier that we were trying to do is, I'm sorry, I'm trying to interrupt myself to share my screen. And one of the things we tried to do is to make sure that we're paying more attention to how, as a program office, we could take some of the burden of application and participation off applicants and participants on the administrative side in order to really help all participants dig in to the work to be done. So I'll take a quick minute to answer just a couple of the questions because, of course, we will share the slides and the recording of this webinar. Again, one of the reasons that we are recording the webinar and have such a, a short sort of administrative overview deck is this is a two-part process. And I'll walk you through the first part of the application process by means of answering one of the questions that we've received about who is the intended recipient of the learning through this curriculum. And it's an interesting question because DASH has always wanted to or has always thought of itself as funding collaborations. But of course, administratively, there has to be accountability and organizational accountability in particular as we pass funds through from the Robert Wood Johnson Foundation, adhere to our own principles and transparency in our grant making. So in this case, however, because asset-based community development is a very collaborative process and it really does require that everyone bring their gifts, the intended recipient of the learning from the process is that collaboration. It truly is a multi-individual, multi-association, multi-institutional kind of approach. So one of the things that we want to see in the applicants and in the finalists are collaborations that are far enough along to know who is actually going to be able to have time to commit to this process. One of the things that I am recommending or would like to see happen, again, because of the short period of time and the amount of demands or the different ways demands show up on people's time, is consider having someone take charge of the application process that's outside of an institution that is often typically the one that would be applying for grants. And I'll show you how to do that. And how we hope we've set it up to make it easy to do that through the application. So in the chat and the Q&A and on the slides that you'll have, there's a link, a direct link to the application website. And I can see that that's not going to do what I wanted it to. So I will say once you click on that link, it should bring you to the RWJF page. Many of you may have already applied for Robert Wood Johnson funding in the past, in which case it will come up to a page that doesn't look anything like this because you're not a program office and you'll have maybe 2 sections as opposed to the 6 or so that I have. But it will have on this page a selected call for proposal, and it will be the asset-based community development cohort. Many of you may not have, or as I mentioned, you might want to use this opportunity to support individuals in the community or association members in learning and developing skills in applying for grants. So someone else might want to take charge of this, in which case they will have to register for the portal. It's an email address and a password, a self-selected password. And I know application fatigue is real, but that is the price of using the system, which I do hope will yield some benefits in the long run as we try to sort of learn from what happened on our end. We are hoping that Robert Wood Johnson Foundation and DASH will learn from this process on that administrative or meta angle. So hopefully that answers that question a little bit. And so once you have logged into the portal and you see the selected call for proposal and you click on this, it will come up with a PDF of the application, which is kind of messy looking. It's 19 pages long because the PDF is going to show you all these fields in a lot of white space kind of way. but when you click on apply, you'll see some general, whoops, you'll see that your session has expired. You'll see that you will get the opportunity. Okay, the dangers of live screen sharing. You'll come to a screen that shows you what the different sections are and contains some general advice about looking at the left-hand menu, which I did save earlier. Advice to look at these resources on the left-hand side for more information about what you are, about the different screens. It's mostly for technical support using the website itself. And again, we recommend that you visit the dashconnect.org page from time to time as we get new questions and answers to post, or some iterations that might lead to more clarity. You can check that site out as well. But so once you're looking at the application, I would like to flag that you have the opportunity to invite collaborators. That's something you'll see in the left-hand side menu if your cookies don't go bad like mine just did. And we ask that you do create just one application and invite collaborators to participate in that one application. If you lose your number or can't get logged back in, please reach out to me directly. My contact information is on the website, on the slides, and I'm very happy to help access any application that are already created so that you don't have to create another and try to figure out where you are in the long run. So you can, there's a number of different sections on the application. Which again, I guess I don't have that screen open, but of those sections, you can work on them separately, save them. You can even save and mark them as finished and come back and edit them later. You just need to make sure that you're completely done with it and never want to change it again before hitting it. And then you'll have to submit all sections of the application by the deadline at the end of the day on December 7th in order for it to actually flow through the into the system. Again, I'm happy to help with all kinds of different kinds of questions as far as that goes, and the Robert Wood Johnson Foundation technical team will help as well. The two sections to look at, first of all, however, is the key contacts and the eligibility questions. And that's where we get at some of these questions about, or an understanding of what we mean by collaborations and how we want those collaborations represented in this process. So there are 3 critical roles, which may or may not be filled by a single person that you'll need to have a commitment from and information about to put in the system. The lead applicant is a person who is responsible for completing the application. It'd be a good idea if that person is also going to be responsible for convening the group and participating in the cohort and be the main communicator with Dash. They may or may not belong to an organization. If they there does need to be an organization, preferably a local institution participating in this collaboration that will take responsibility for the award itself, has the legal ability to sign the award letter and receive funds and distribute funds according to what you have proposed when at the various stages of the collaboration. So again, these 3 contacts are required. You can copy and paste amongst them in case they are all the same person, but they don't have to be. Then there's also room for 2 more contacts. You don't have to limit yourself to that, but we do require that at least one other individual or organizational representative be a committed participant in this process in order to move forward. And in order to demonstrate that, we do ask that you create and submit letters of commitment from those participants. There is a section for supporting documents where you'll see that those documents can be created electronically and then converted to PDF and uploaded, or if you prefer to email me a JPEG or however that is most convenient for your collaboration, we can accept that kind of information a number of ways. However, if you are submitting supporting documents through this application portal, they must be changed to PDF, otherwise they're gobbledygook and we won't know what they say. For whatever reason, they only accept PDF uploads. Again, that's a little information about the key contacts and how we're thinking about the collaboration that we'd like to see participate in the actual activities themselves. So in the eligibility section, we have some sort of baseline participation criteria that you should be aware of. Again, the collaboration, in order to be successful with so much work in such a short time, this isn't really an opportunity to start convening. It might be a great opportunity to start convening around asset framing and thinking about your community in that new way. And part of the curriculum, you will be doing some of those activities that Ron and Daryl described. You can be sort of upstream as far as that goes, but you do need to, again, have letters of commitment from people who will be supporting this process and committed to sharing their gifts. So we have some sort of information for you to be thinking about how do you know that your collaboration is ready, and how can we be sure that there is a collaboration that does have some of these things ready to go. Also, because we are DASH and we are looking to examine and support infrastructure that acknowledges data as a community resource and infrastructure for that as an asset. We'd like to know that you have had some thoughts or a vision for shared data infrastructure, or share how your collaboration will share data amongst itself and with the community. So the additional organizational requirement is, again, for there are the two roles, an institution that can sign the award letter and receive the fundings. That type of organization must be a nonprofit organization, a government entity, or an academic institution. The organization should be a member of that self-same multi-sector, multi-focus community collaboration. We do give you a chance to sort of explain some potential conflicts. For example, we do have had some fiscal agents engaged, which is fine, but you'll have a chance to explain that there. And we are only funding organizations and collaborations in the United States or its territories, which is one of our general requirements. So then we have 6 collaboration questions that should be, again, fairly easy, because again, if you can answer these questions, if you're best prepared to participate in this opportunity overall, these questions should be fairly easy. You don't necessarily have the answers to all of the prompts or all of the questions, and that might be fine. We just ask that you be thoughtful when you're running through these questions and thinking about, if we can't really describe the manner and how often this collaboration meets, why is that so? Why do we still think that we can turn on a structure or a schedule that will help us participate in this collaboration? That second question is the largest of all, again, because it's really asking you to dig in a little bit to describe the collaboration itself in a way that helps you think it through and us also understand the types of collaborations that will be participating. This will be helpful also in the co-creation process, as we're thinking about the cohort itself and building out the curriculum to be more specific or helpful to the participants. Again, we have a place to be thinking about the primary stakeholders and partners in the collaboration and what they look like. Again, we'd love to see more applications from collaborations that are being led by Black, Indigenous, or Latinx leaders or members of a community that are experiencing the effects of systemic racism. And although we didn't do it ourselves, I'll flag this. This would be one of those questions where we would have to say, no, we're not sure about the demographic makeup of the organizations participating, or perhaps all the collaborations, because we didn't collect that information. But it's a chance, now it's a chance to start thinking about how and why we might want to do that in order to move forward. So again, answering everything as thoughtfully as you can, but also as succinctly would be very helpful. We are interested in the collaborative visions for racial justice and health equity. Again, one of our meta learning goals for this entire collaboration is how we might be better grant makers and more equitable grant makers, but also how we might understand how grant making in communities can help communities focus on equity, and what we need to look out for in cases where it might not have. We do understand that sometimes funding can have a negative impact. And then we have a question again about the collaborative experience with an interest in using data to support their health equity strategies. We're all on a learning journey. And it would be helpful to know that, again, in terms of building out the final cohort. And again, now that you've had a brief introduction and some resources to learn more about asset framing, trying to think through a little bit about that collaborative that will be participating, hopefully, or is applying to participate in the long-term curriculum, what the experience with or interest is in leveraging community assets. And you might find that you have been doing it for a while and didn't know. So that is essentially the scripted questions for this round, for this application. We are asking you to consider for the funding itself, the larger amount of funding. What would your collaboration be needing money-wise in order to complete this curriculum as described? Like, would you need to rent spaces? Would you need to pay to provide childcare for participants? Is there, food is always a draw, and a lot of this work does get done at meal times or times outside of a 9 to 5, a bank day, I guess I'll call it. So there's all kinds of things that might be used for. And at this point, we're interested in what your needs are. It will come back as part of the community showcase with any more budget requirements at that time. But one of the things that we learned over the years in creating funding programs that asked for project proposals is that it left us without as much insight as we would have liked into what actually communities need. Like where is the money actually needed in order to work together and create change at a systemic level. So that's the budget. It's not really a template. It's just maybe a description of how you think you'll use that funding, and a chance to also consider things that we might not have listed here. And so finally, the supporting documents, again, you do need letters of commitments from the key participants in the cohort. Must be more than one. So at least 3, but not necessarily limited to that, just being mindful of the time, and many people will be on a holiday. If you are finding that to be a big barrier, you can always reach out to me and we'll discuss how we might address that. Again, any optional appendices, which could be your, some collaborations might be very mature and have their own websites and governance and a lot more information that you think would be helpful for us to share. Anything like that that you'd like to do, we're very interested in seeing. Again, just a reminder that everything must be converted to a PDF prior to uploading it. So that said, that's the basic level application, and I do see some more Q&A coming in, so I'm going to stop sharing my screen so I can look at that and take a look at the Q&A. I think I'm stopping Cheryl. I haven't yet.
Oh, there you go.
So thank you for Susan putting my contact information in the chat as well. we have a good amount of time for Q&A, so I'm going to check what is out there. Again, hopefully I answered the first question about the intended recipient of the learning. And we have a question from a president of a community-based nonprofit. So the funding, does it have to be used on new projects or can it be applied to existing projects? The answer is hopefully either. It definitely does not need, we were not requesting that you create a project. So
right.
Again, the process that we'll be embarking on might lead itself to new project creation, but it's not required to do that in advance of participating in the cohort. If you are already working on, if your collaboration is already working on some things and you want to bring in this asset framing process to that, that's great.
Yeah, I think it's important to distinguish between supporting a process, an organizing process, inclusion process that helps residents really co-create the change versus a project that might be very defined and just has sort of the delivery of some outcomes. This is more about the trying to support work you all may be doing in your communities with collaborations and partnerships of people to help take some of the financial burden of things that are often necessary for that, like stipends and childcare and transportation and meeting spaces and buying access to good data after a research action that you need, more than, say, paying for slots of childcare or something like that. Which relates to I think there's a question about health equity or broader community organizing. What I like about what Dash has done with this is it doesn't have you propose, here's the program we're going to do and the outcomes we're going to achieve, because part of what they're willing to fund here is you getting together with residents and doing that, identifying what that is. What are the health issues in the community? What would health equity look like? And the reality is if you're tapping into the sources of health inequity, you're tapping into the sources of a lot of other issues too. And so you don't need to silo it. It may just mean broadening the conversation a little bit. That a conversation about safety is often a conversation about health, which then can also lead to a conversation of why do the kids in this neighborhood have more asthma than kids in other neighborhoods? And what's the nearby dump have to do with that? So it's a broad approach. We're not looking for, here's our one health equity outcome.
Right, and to that end, we do believe that communities have such a variety of different kinds of circumstances and assets and challenges that we are trying to be less prescriptive as far as that goes, because again, we have not yet been able to determine the one size fits all. So while there's not a one size fits all kind of eligibility or thing that we're going for, again, we're trying to think about participation requirements or, quote unquote eligibility as being ready to have to have that conversation or dig into some of those questions with your collaboration. So a specific question here, any part of the support geared toward organizations who serve and collaborate with ASL and Spanish speaking or ASL communities? Absolutely. Again, that would be up to the collaboration that would be participating in the curriculum to decide what kinds of needs are to bring those assets into the collaboration and how we might support that. And clearly, yes, it would be great to have those translation resources available if needed. Hopefully we talked about the eligibility requirements for the application. Again, essentially you have to be a collaboration that's ready to participate. A little hard to put the hard and fast on that, but we gave some guidance around that. And then one of the participants and or fiscal agent has to be an organization that can sign a letter of agreement and receive and distribute funds. I want to.
On that, there's a question about universities. With this small amount, I would find a different applicant in the collaborative. I mean, universities usually run like what, 40 to 60% in my experience, which may not leave you a lot. So there might be other partners in the collaborative who could be the applicant, so you don't have to put that in, but we could have that conversation offline with university folks, because I know that's hard.
Right. I do want to address a question or a comment that we have to say, first of all, thank you for the question and the fact that it's also a comment about it's one more thing. Like this is feeling maybe it's like a different kind of burden or a new burden to access funding for an organization's or a CBO's attempts to participate in or drive collaborations for equity. I think that's quite fair. And one of the things that we are definitely interested and willing to iterate on is the amount of support needed, which is why I do encourage special situations or insights into what kind of support a particular collaboration needs in order to participate or find it less burdensome, can reach out to me directly. But it is also another reason why, in this case, we're being very intentional that a collaboration already does have to exist. And to Ron's point earlier, you may very well find that you have individuals and institutional representatives and others who can do some of the things that the lead applicant couldn't, right? And that's the amount of collaboration that needs to be in place. There's another question out there about how much collaboration needs to be in place. Again, that's one of those variables and uncertainty that we're not quite sure, because it will depend on your own community's readiness and needs for that amount of collaboration. But in order to participate in the overall curriculum, you will need to have that committed participation from at least 3 different kinds of stakeholders or individuals, institutions, associations, kind of participants.
I think that part of it is too, if you're looking to fill a project or program budget and access this funding for that, it's probably not worth it. If you're in a community conversation with residents and other associations and other organizations in the community about, you know, how to support community-driven change towards a healthier place for people, then this hopefully can remove some financial barriers and provide some added coaching, training, peer learning.
Right. I wanted to do another twofer in terms of the funding and the expectations for the funding. Again, we mentioned the 2 rounds for the mini grant on 12/7. Those collaborations will need to have a representative participating in review, both creating a showcase of their community collaboration and the work that they are looking to support the process, and review those of other potential participants in order to create a short list or the list of actual participants. It's going to be a now I can't remember the way we finally determine on how to call it. It's not quite ranked choice, but it's you know, everyone will get a chance to review the other showcase presentations and decide what are the 10 to 12 best fits for working together in a cohort, including yourself, of course. So that's the 12/7, and then for the larger amount, again, the curriculum is set. The expectations is full participation in that curriculum, and some reporting out on it as we go. But there's it's embedded in the curriculum that some of the things that will be created is an asset map for your community, I believe an action plan, and working on operational budgets as well. It's that seems to be a common need for the collaborations. So Daryl or Ram, would you like to answer about ABCD training without having to go through this competitive process?
Daryl, you want to talk about that?
Yeah, yeah, I just saw that question from Ivan. I thank you for that question. I guess I'm just thinking, like, is this something that could potentially align with your work? Because I'm wondering if, as you go through this, if you have a cohort of or a collaborative that's already in place right now, this could be of benefit to go through with others and get a small amount of funding. So I mean, I think there is a way, but I would encourage you to apply to this and go through this with those you're collaborating with, because you'll be able to go through it with others who will also be able to speak into the work that you're doing in Houston. So yeah, that's what I would just say in response to that question.
The ABCD Institute, can help you connect with a trainer who can do this. They'll charge something, so that's why.
Yeah.
Daryl's answer: try to get it for free here.
Yeah, right.
Plus, I mean, I don't want to underemphasize the peer learning part of this project is really valuable. You'll be in a cohort with 12 other folks, and even the part Melissa just has talked about, where the finalists will be asked and given money to help offset people's time to review other applicants, is a great learning opportunity right off the bat to see what other folks are doing and how they're doing it. So a lot of this was designed to, help you expand your own connections and learning from other places who are trying to do similar things. Along with community partners, we're specifically looking at youth mental health. Want to clarify that that'd be a fit within health equity frame? Absolutely.
Absolutely.
Yeah, we actually had a question on the application early on about your health focus or your health equity focus, but again, that is something that you might want to let evolve over the course of doing the curriculum, and so we thought we would put that off till the second round of showcase to get an idea of what you're thinking in terms of the area of health, and then at the end we'll find out what the community decided.
It's USA only, right?
That's correct. US and its territories.
Territories. I think we started to answer this, but a question about the outcome we're looking for from applicants to receive funds. Looking for you to have a community engaged process that leverages local assets and residents to identify what changes you want to make. It's a short time frame. There's no expectation that you will have created health equity in a neighborhood by next year. But we also, as Melissa said, aren't trying to tell you what outcomes to have. We understand that, we want your community to decide that, and hopefully are helping you develop a process where that can happen, and the community can not only decide, but also co-create those outcomes with you.
Right. I'll pause a moment. I feel like we've answered the questions that I've been able to see. If you, yeah, go ahead, Ron.
Maybe reiterate how long it goes and what the amounts are.
So the first round finalists will receive $2,000 in order to create a showcase presentation. We'll have a bit of a light template for that so that everyone will have the same type of presentation, and then there'll be an expectation to review or the right number of finalists would be 30 to 40. So probably review up to 10 other showcases in order to help us finalize that cohort, and also invited to participate in some iteration along the lines of the person earlier who was concerned about making it a light, making sure that the lift wasn't too heavy. We'll be able to engage those finalists on some on getting your input into the process and what some of the selection criteria might be along the way. The second portion will run through mostly through July of 2022, although there's reporting and some other things. So I mentioned August 22 is the end date. That's $22,000 for participating in that curriculum and doing the convening work and creating those asset maps and other products and reports along the way.
I see a question here mentioning a collaboration that already exists within a church to fight vaccine hesitancy, and would that be eligible? I think yes. I think with that group that's gathered, just considering how those outside the church and the surrounding community are also engaged in that work. I'm not sure if that's just happening within the congregation or if that's a community effort. So I think that's just one thing to recognize in that question.
Thank you for catching that one.
Mm-hmm.
I am pausing to see whether there anyone would like to retype a question in case we missed it. We're not deliberately ignoring any of them.
Really quick, hi, Melissa. It looks like we have, I don't know that this was addressed, how much of the core group needs to be in place before this application is submitted? Could you just clarify that one? Or anyone, sure. The panelists.
Sure, it's part of the application, so you'll be reminded there as well, but there needs to be letters of commitment from 3 different types of participant in the collaboration. So it's a bit tricky thinking through, there's 3 key roles that need to be identified in your contacts, but then an additional 2 types of collaborators. They might represent different areas, what we would call sectors or foci, and there's a place in the application to describe what each committed participant is bringing to your collaboration. And then in the letter of commitment, it should clearly specify what that person who is committing to participate, whether it's themselves as an individual or on behalf of an organization or representing an organization or institution, what they expect to have to do. Again, there is a curriculum, so they'll be expected to participate in that as the collaboration decides to assign those roles, and also what they expect to receive. Do they need to be compensated to do it? Do they, are they expecting to be part of a longer term project or effort as part of this? So just to make sure that there's enough of that core group, again, to indicate that the collaboration is ready to go and can participate fruitfully. We don't expect it to end there, of course, but there's about 2 to 3 members to keep participation going and completing some of those activities together is important to have in place. And Daryl and Ron might actually have some more real world examples, but.
Some more questions coming in. Yeah, so one question was, my community is historically Black. Today our population is 52% Black, 29% Latino or Hispanic, and 90% white. We've been working on community engagement methods to unite the community. Can this funding be used to support that kind of work? Yeah, absolutely. I mean, that's the kind of community that we're hoping to invest in, and the kind of work, the the application would want you to bring together who in the community are you working with to make that unification happen, and how are you asking folks to come together to think about what they want for their community, and what that has to do with health, and what kind of information and things you need to do to make that happen.
Yeah, and a question just came in around selected collaborations will be asked to implement the curriculum that we mentioned in executing their work toward their own selected objectives and goals. Yep, so that's right. So that is correct. So the curriculum that we'll be using is simply tools that help support that work. So we don't dictate the outcomes. You will do that, the objectives and the goals, but these tools support that work and kind of reorient to have more of an asset-based approach to that work.
Thank you. I want to interrupt a moment. Thanks to Ron for reminding me that there is an exit poll as you leave the webinar. I see we've already lost people, but I wanted to highlight that it's not just the Zoom, how did this go kind of poll. We are interested in giving you the opportunity to, first of all, give us maybe a sneak peek on whether you intend to apply, and then any other comments or questions that have come about as you are thinking through whether or not you're going to apply. We'd love to have some of that feedback through that poll. And now that we are down to a smaller group, sure, Susan, let's go ahead and turn on the chat as well. We are almost to time, but it would be an easier way to collect any last minute questions or answers. And thanks for those who used the Q&A to already support each other in peer learning. I noticed that Baker Ripley team in Houston does some great ABCD work. There's Houston, who is the one who was looking for different ways to learn about asset-based community development tools. So thanks for that. And yeah, any other questions that you have at the last moment, you can put in the chat and or in the exit poll, and or email me directly. You'll again have the slides with my contact information, and we'll be updating the dashconnect.org/CIC page with some of these general Q&A, more detail about the amounts in curriculum now that we have made the announcement, and the link to apply.
Can we put up the poll to see how many folks think they might apply?
So it's not up as a poll, it's as an exit survey. So when people close out, they'll be able to see it.
Got it.
Yeah. But if for attendees who are listening, if you'd like to tell us in the chat, if you are thinking about applying, please feel free to chat it in.
Yeah, that's one of the the areas of uncertainty and iteration. We're very interested in how many applications we might be looking at, because we will have to do some iterating depending on numbers, whether they're low or high. If they're just right, then we'll be ready to go. But yeah, it'd be interesting to know of the many mitigations that we have discussed, what we might be looking at. All right, and again, hopefully the application, this level application itself is meant to be descriptive and a pretty light lift for people who are ready to go and are working in a collaborative environment. Really hope that you'll give it a chance, and if you run into something along the way that we might be able to address, again, please feel free to reach out. So we got some San Diego folks who are encouraging each other. Thank you very much. To the extent too that you can pass on this opportunity to others in your community. Again, maybe you're not ready, or your organization isn't necessarily the one that's ready to take responsibility, but perhaps there are other shapes of collaborations and convenings already going on that would be interested in taking the lead and including you that way. So yeah, easy or difficult to get a fiscal sponsor on board. I'd love to dig into that a little bit more as on. There again, yeah, I would just like to dig into that a little bit more. Even if you want to reach out to me directly via email, we can discuss that particular challenge, because I may not have described it very clearly. So I noticed this open source tool sets. The Asset-Based Community Development Institute is a treasure trove of toolkits. This opportunity is more of a supported and funded way to experiment with using some of them. But we do also hope to create some that are more specific to data sharing and recognizing that data and data infrastructure as an asset. So yes, that is one of the things that we would like to build out of this and share out. Yeah, shout out to Durham.
Mhm.
They already got collaboration and DataWorks in place. Eesh.
All right, this sounds great. With that, we are at time, so I guess we're going to have to say goodbye for now. Again, we will be sending out the recording and slides to everyone. Check the dashconnect.org for the various links and updates, and look forward to working with some, many, or all of you all throughout the next year.